Hi, it's Andreas Gomoll. I've been asked to do a quick video review of our recently published paper for AJSM. We looked specifically at the use of pulse lavage in osteochondral allografts, and this was an experimental study. We used 4 different sizes, 2 different diameters combined with 2 different thicknesses. The reason we try and decrease bone marrow as much as we can is that this is the only thing that is really immunogenic in the graft itself and can incite a immune reaction. It's a low-level reaction. It's not really like a graft versus host or host versus graft disease, but nonetheless there are thoughts that this might be responsible for subchondral collapse of the graft, which is a common failure mechanism in osteochondral allograft transplantation. And we did something new. We used both regular histology, but we also looked at DNA content. And our histologic findings were pretty similar to what previous studies had shown. That is that pulse lavage can reduce the amount of bone marrow, or better, it can open up the marrow cavity and clean that of bone marrow content. The DNA extraction, however, showed that we were really not able to reduce DNA content very much, meaning we weren't really able to truly remove bone marrow from the graft. Why is that? Why is there a discrepancy between the 2 findings? Well, our theory is that the pulse lavage, rather than irrigating it out of the bone, really concentrates and pushes the bone marrow just into the deepest parts of the plug. Therefore, even though on histology it looks as if we cleared up a lot of marrow space, it's really just more concentrated in the deepest part. Therefore, DNA content is not really reduced. So ultimately, do I still pulse lavage? Yes, I do. What do I do differently? Well, there are thoughts about perforating the plug to make it more easy to access the deepest parts of the plug with pulse lavage, but more on that later. Thanks very much. Bye-bye.